Alrighty, so today I'm speaking with Laura Rupsis, Director of Health Coaching at Simplex Health. Simplex has spent over a decade proving that type 2 diabetes can be reversed, not just managed, through a structured medical nutrition therapy approach. What began with founder David Rambeau's personal journey has grown into a model that blends dietitian expertise, health coaching, and technology. Now, Laura is helping lead their expansion into the employer market, bringing this proven method to organizations struggling with the rising cost of diabetes. She brings a rare mix of entrepreneurial and clinical insight. In this conversation, we'll explore how their programs achieves remarkable outcomes while they're pivoting into corporate wellness and what it means for the future of diabetes care. Welcome, Laura.
Thank you very much. It's good to talk
Happy
to
to
you.
Yes, excited for this. So let's start with David's journey. Can you share David's journey and how it inspired the founding of Simplex Health?
Absolutely. So, David and I actually met at the gym when I moved to Florida about 5 years ago. So, I got to know his story that way. We connected, both of us entered health and wellness through our own personal journey. But David was always sort of in the fitness realm. He ran and managed corporate fitness facilities. So, think large corporations that had a fitness center on staff or multi-tenant buildings in the Philadelphia area and they needed a fitness space managed and run. So this man was in the fitness business and was in his, I want to say, late 30s, progressively moving closer and closer to a type 2 diabetes diagnosis. Started out pre-diabetic. He was working with the best endocrinologists around Philly area. Yet, no matter what medications he was on, and even following the diet he was originally prescribed, he was just getting worse. His blood sugar kept rising. And the rubber really hit the road when his practitioner, his doctor, finally told him, look, this isn't working. You're going to need to actually start taking insulin, inject insulin. So, this is a man in his late 30s, popping pills. He's got young children, doing what he's supposed to be doing, and he's just getting worse. So, he left. He did not go down for insulin treatment. Called the functional medicine doctor working with him and helping him with his eczema. And he explained his situation and said, can you help me? And that functional medicine doctor said, yes, I can help you. Come on in. And he changed the way he was eating. I'm sure there was more to it, but the vast majority of the healing journey had to do with changing how he was eating. It was a whole food based, it was lower in carbohydrates, getting rid of all of those processed carbohydrates, focusing on healthy fats, prioritizing protein above ground vegetables. And in about 3 months, he was in remission. Remission using food. And so at the time, David, the founder of Simplex Wellness, was thinking, how do we bring functional medicine to more people who might not ordinarily be able to afford to pay out of pocket like that, to pay for a functional medicine practitioner? They're not cheap, many of them. And that's when he started thinking in terms of why don't we start using insurance benefits dollars in order to be able to bring this to people who wouldn't ordinarily pay out of pocket. Then he founded Simplex Health, which is his sister company that I'm working for now. He still owns Simplex Wellness. But Simplex Health started with one dietitian and a health coach. We now have over 20 dietitians. We have many health coaches. We serve thousands of patients a year. And reversing diabetes is just like an everyday Tuesday. It's no longer a big surprise anymore. Happens every day.
That makes me so happy to hear.
Mm-hmm.
So
Me too.
many people hear reversal and think it's impossible. So how does your approach make that achievable in just months?
Well, when you think about how type 2 diabetes is actually diagnosed, it's through chronically high blood sugar. Well, you remove the components that cause the high blood sugar, the body now has the ability to heal. Maybe a better term is remission than reversal. Because if you go back to eating the way you ate before, the diabetes will come back. You need to remove the rock. That's a term that we use when we think in terms of functional medicine. The analogy being, if you're walking around with a rock in your shoe and your foot hurts, you can take a pain medication and the pain will probably go away temporarily. But if you just remove the rock, then the pain goes away for good. You just can't put the rock back in.
Love that analogy. So you led health coaching at Simplex, and how does coaching integrate with nutrition therapy to create these lasting results?
Health coaching is all about habit change. It's about behavior change, habit change, motivation, accountability, because we can change what somebody eats. And I don't know, most patients are good, at least in the short term. We see this all the time with chronic dieters, where people will adopt a diet, they'll lose the weight they're looking to weight. It works until it doesn't work. And there's a number of reasons why the quote unquote diets don't work, being they work until they stop working. And it could be for any number of reasons. The number one reason is because many of them aren't sustainable. You're not eating enough food, you lower your basal metabolic rate, you get bored, stress ensues, whatever the case may be. So, knowing what to eat is just one piece of the picture. Actually doing it repeatedly and successfully over time until it becomes the norm and the habit, that's a completely different story. And that's
Yeah.
what health coaches do.
And even just thinking about like before you go to the grocery store, what does your list look like? And when you get there, are you following the list? Are you going off the list? Are you seeing that bag of Cheetos or something,
Right.
and just throwing, and you're going to just throw it all off. Yes, they taste good. Not knocking it, but
Mhm.
like, don't go down that aisle, right? Like
Absolutely.
there's quite a few aisles you just need to stay off of.
Well, you know what? You've probably heard this a lot. We talk about shopping the periphery of the grocery store because it's the periphery. If you ever notice when you walk into a grocery store, all of the fruits and vegetables are on an outside rim. The deli, the meat department, the seafood, the dairy, all that stuff, they're on the perimeter. And it's not that there isn't good stuff down the aisles. You can get olive oil down an aisle, maybe some canned tuna, some nuts or whatever. But the vast majority of the stuff that's in those individual aisles is processed stuff. They've gotten smart. They now put processed stuff on the end caps so that as you're walking the perimeter, there's the
They
Tostitos.
catch you. Yeah. It's all
Right.
about that marketing, right?
Exactly.
Strategic placement.
Right. So it's all about helping the client or the patient build an environment around themselves to help improve the odds of success. So if you're someone who can't go to the grocery store because you will buy the Cheetos, do you have the financial flexibility to pay a little bit more for grocery delivery? So you just load your cart online and have someone bring it to you, or perhaps a meal delivery service. There are many, many out there now, and the cost of meals has come down quite a bit. You can get meals for $12 a piece. That's what it costs at Chick-fil-A these days for a meal,
True.
right?
Yeah.
You
Or
can
or
get
more, depending on where you are.
exactly. You can get
Yeah.
a better high quality balanced meal with some of the, so this is what I mean by helping the patient actually create the environment around themselves to try to avoid the things that they know are their triggers.
I love it. So why is now the right time to bring this model to employers after like a decade in insurance-based care?
Well, there's a couple reasons. The first one is we have a decade under our belt now, right? So from a marketing perspective and saying, "Hey, we're new to this space, we're new to this corporate space, but we're not new to doing this. We've been doing it successfully for over a decade now." But also, the rising cost of chronic illness is mind blowing. We spend more on healthcare than any other country, bar none, but relative to other sort of advanced societies, we're the sickest, and it's not stopping. We believe that this, again, going back to this driver for David, how do we bring this experience to those who might not ordinarily be able to pay for it out of pocket? Where insurance companies in the US based insurance pay system is helping to pay the bill for those people. There are more and more corporations now that are self funded who are actually paying the bill, not necessarily insurance companies anymore. So if we can go straight to the corporation and saying, hey, this is about what it's going to cost, to get rid of this condition. And we can just work directly with you rather than having to go down the rabbit hole of insurance reimbursement, which is a nightmare and a whole other conversation.
Yeah. And just like that investment and thinking of longevity and what it does for the company and their employees. And wow. Most wellness programs only reach the people already engaged, right? So how are you reaching employees who need it the most?
This is where we can work directly with an employer's TPA or their benefits broker. We can't work, so the idea is targeted outreach. We need to be able to identify those who need this. The employer doesn't know. There's HIPAA laws involved. Their employer does not know what conditions they're working with unless they choose to share it with their employer. But their insurance company does, their TPA does. And so we can work, there's like this firewall, so employers don't know. We can go directly to the TPA just like we would to a doctor on the clinical side, where the TPA then can help us identify those who have diagnostic codes, that is type 2 diabetes, prediabetes, hyperglycemia, even hypertension, cardiovascular disease, dyslipidemia, like these diagnostic codes. But then also targeted medications, GLP-1s, for example, they're commonly prescribed for folks with type 2 diabetes, but also insulin, metformin, these medications that actually help lower blood sugar, or conversely, have the pancreas secrete more insulin, depending on kind of what medication they're on. So we can identify these people and we reach out and call them.
Yeah.
Okay. Literally, it's calling one person at a time, the exact people that actually are the target population for this.
And just help them, get back, get on track, start like, wouldn't you like to improve your health and have to stop taking these, constantly in at the office, doctor's office, changing meds, getting these meds, all the headache that comes with it, losing time from work, enjoying
Right.
life a bit more.
And we're just going to move forward, not saying, hey, I picked you out of a list. Nobody wants to hear that. It's just, this is a new program your employer has adopted. It's available to everyone. However, it's aimed at people like this and sort of describing the patient that are diagnosed with this or on these medications or experiencing these symptoms. These are the people that are the most likely to benefit from this program. It's completely employer funded, meaning you don't have to submit any claims. We don't need your insurance card. Your employer is going to pay us directly, but your employer doesn't know that they're paying us for you. They don't know you're the one who's involved. They just know that an employee is involved.
And it's kind of like, do you think something like this would help you? And they have that aha moment, hopefully, right? And yeah, and it's like, wait, it's not going to cost me, my employer. That's amazing. So thinking of like the technology impact, how are continuous glucose monitors shifting behavior change and patient empowerment?
In a few ways. So the use of a continuous glucose monitor gives you real-time data on the fly as you're moving through it. So first of all, many people will use it just to sort of see their response to a given meal. We'll run some N=1 experiments sometimes. If people are missing a certain food, for example, or they're trying to figure out what their threshold is. For many people, for example, rice is a big no-no, especially white rice, but rice will spike just about everyone. I don't care what you eat it with. But we can try other things to kind of replace that. Well, if rice doesn't work well for me, what about black beans? What about there are these noodles that are made out of chickpeas, for example? And also, what's the dose? And also, under what circumstances can I eat these and have them be okay? And I'll give you an example. I've been testing this myself. I have a CGM, and there's a neighbor of mine that makes this beautiful gluten-free sourdough bread. It's like this organic heirloom sourdough bread that's gluten-free. And I tasted it. She made it. She knows I eat that way. And I sat down and I took my dog for a 2-mile walk, had a few eggs and a piece of this gluten-free organic sourdough toast. And my blood sugar went from, I don't know, 90 to about 140. I'm clearly not diabetic, but that's still a pretty big rise, about a 50-point spike. So then I tested the exact same meal. I still went for a 2-mile walk, but I had a strength training session before I ate that meal. And my blood sugar went from, it's probably a little lower by then, about 85 to like 111.
Oh, okay. Oh,
Big,
wow.
big drop. And it allows us to have a conversation to say, okay, this is the role activity plays and how my body uses energy. And perhaps if I want to consume certain carbohydrates that I miss, perhaps I consume them around my workout, either right before or right after my workout, and actually give my body a chance to use that for what it's supposed to use it for rather than storing it.
Okay, I have to ask this because you mentioned white rice. How do you encourage or change or substitute someone that white rice is just part of their carb or their starch. It's part of their, regime. It's like it's not potatoes, it's not pasta, it's rice. What do you recommend?
Well, we can try swapping it out. I mean, some people will move to brown rice. There's really not much of a difference there. You really need like a wild rice or these sort of pseudo grains that aren't really grains. They're more like grasses. Quinoa for some people respond better to quinoa than they do to rice. Um,
Basmati rice, I think it's called. I've
some
heard
people
it's got
find they do
lower.
yeah, some people find they do better once rice has been cooked and cooled because it becomes like a resistant starch. But this is why that CGM is so important because we don't know how well you're going to respond to this kind of stuff. So let's test various theories, test different replacements, test different serving sizes. Maybe it's just that you can't have a cup of rice, but you can have a half a cup of rice
Interesting.
and
Okay.
be okay there. And by the way, that means that we can make up the bulk in your meal with more vegetables or more protein and just a little less rice. I'm a big fan of like squash and purees. I love spaghetti squash. It makes a great foundation for just about anything, but not everybody likes the flavor. So this is where health coaching comes in because your dietitian can give you all these ideas, but she's not necessarily going to be with you week by week, chatting with you in between. She just doesn't have time. This is what the health coach is for, is to build these deeper relations and help them troubleshoot this stuff.
So employers face, according to American Diabetes Association numbers, roughly like $12,000 or so annual costs for diabetes. So how do you frame your program, roughly around 3,500, to these decision makers?
Right. So that's not our number. To your point, that's the American Diabetes Association says on average a little over $12,000 a year per diabetic for diabetic related costs. That's not other comorbidities, loss of productivity, any of those things. Our program is $3,500. So for $3,500 in 12 weeks, we can reverse that condition. And that $3,500 includes continued care for 9 months. So we can sort of reverse the condition clinically using sort of lab results saying, hey, glucose is down, A1C is better, insulin's better, all that. Okay, we're in remission. But now we need another 6 months to make it stick because the big savings are going to come in year 2 and year 3 and so on. So you've got your 12,000 a year. This same employee 3 years from now is probably closer to 15,000 because not only are they still diabetic, but now they're on other medications, they have other conditions. So that's the way we frame it. So I mean, you can do the math of 12,000 minus 3,500, that's a change of what, $6,000? No, more than that, $8,000 or so in the first year. That's kind of simple math. It's not always that simple. We don't have control over when a doctor is going to pull medication away and stuff like that, but we feel confident there will be some savings in that first year, but it's that second year, third year, and moving forward where their medications for that conditions are no longer a concern, and likely medications for other conditions may no longer be a concern as well. Mm.
Yeah, because through correct diet and all that, you're starting to remove hopefully a lot of conditions. That's great. So with so much buzz around GLP-1 drugs, how do you position a food first sustainable solution?
The GLP-1 medications are what prompted us to build this program for corporations. We were getting corporate platform partners. So these are companies that do these wellness platforms that you're talking about that really, you know, 20% of the employees use, and they're the ones that are likely to be engaged anyway. And they're telling us their employers are just rabid for some sort of solution to stem the cost of these GLP-1 medications. So clearly, we can reverse diabetes with just nutrition alone. That's fantastic. But what a lot of employers really want is either some sort of gatekeeper solution or an alternative. So, what we're hearing now is employers want to be able to say either you have to be going through this diet and lifestyle program in order for us to pay for that medication, or you have to have completed this program first. And if you've done that unsuccessfully, basically, you've proven to me that this doesn't work for you, then we'll pay for the medication. That's the way many employers are looking to use it. We are hearing from some employers that they want us to not only be the gatekeeper and provide the lifestyle, but they want us to prescribe the medication because many pharmacy benefit managers will fill the script regardless. They won't act as that, like, no, you have to have gone through this first. So that's going to be the next iteration of this is working directly with pharmacy benefit managers saying,
Wow.
yeah,
Okay.
I know.
So you're working with benefits brokers. What advantages or challenges come with that approach?
And I don't know if I'd call it a disadvantage, but the challenge, to your point, is finding the right ones. Not all benefit managers, just like not all employers, have the same come from, in terms of their priorities. So what we're looking for are benefits brokers that, first of all, want something different in their pocket that sound different than other solutions that are on the market today. But also these benefits brokers that feel the way we feel that the healthcare system's broken. It is not working for the patient and it's not working for the practitioners. It's working for someone, clearly, or it wouldn't be a multi-billion-dollar business. But it's not working for the end users and it's not working for the people that are actually working in the system. And the benefits brokers we're talking to are brokers like that.
Okay.
They understand that benefits offering are not making people better, and they have kind of this personal drive to fix that. And we've identified a professional group of brokers that all believe this. It's called Health Rosetta is the name of this organization of benefits brokers that are really driven to do this.
Good.
So the biggest challenge is identifying those.
Okay. Yeah. It's like, how do we duplicate you? How do we?
Exactly.
Yeah. It's even getting them to speak about, why, like the concern and the care around it and that extra layer and what do you really want to do for your clients and how do you really want to make an impact? I
Right.
love it.
I mean, it's making the case for why and from the employer perspective, why taking care of your employee is the right thing to do,
Always. Yeah.
and you've got,
First,
yeah,
take
absolutely.
care of them and the company will be taken care of, right?
Right. But, recently we've identified other possible avenues. I attended a conference for these Health Rosetta advisors, and the brokers are just one avenue. I met employers that were there that build their own benefits platforms. They're not working with a broker, and they're there for the same reason. Our employees aren't getting better, and the cost of their care is just getting more expensive. They know this. They're very involved in their own cost of benefits. So we can go direct to employers. We don't want to do that at the expense of our relationships with the brokers. But if there's an employer that's not working with one, we
That's a
also,
question to have. Yeah.
yeah, there are also now benefits platforms that are built to do this. So they're chassis that don't use a standard Blue Cross Blue Shield or what have you, but it's a platform that works with direct primary care providers so they can lower the cost of doctor visits. That direct primary care can now act as the quarterback for other care. And that's what these platforms do. They have truly preferred providers that we can. So providers like Simplex have to compete for a spot on that platform. It's not like as long as you can fog a mirror and you're willing to pay us like Blue Cross Blue Shield, it's this platform. They kick the tires. They look under the hood and they make sure the solution is what it says it is and does what it says it does. And we're aiming to get this solution on those platforms as well.
What about like HSA platforms, like health? What is it? Health Equity is
Yeah,
a
health
really good
savings
one.
accounts.
Yeah. Would that make sense to be like a part of their platform or?
That's part of the platform, right? So when either a broker or whether some employers do just sort of have it in house, they have their HR department kind of build this stuff where that can be written into the plan that those dollars could be used for this. And there are some employers that we're talking to that kind of want the employee to have some skin in the game. So they're willing to pay the bulk of the cost, but there's some sort of skin in the game where the employer is either paying a portion or if they back out, they have to pay it all back or something like that.
Some criteria is whatnot. We want to make sure that you're involved, like you're actually going to do this too, if we're going to front the
Right.
bill. Or
Right.
if the employer's strategy succeeds, what does Simplex Health look like in the next 2, 3 years?
Oh my gosh, I feel like the sky's the limit. I really do. The clinical space where we're working in this fee for service insurance pay model will always be there. Those patients need us. However, going towards this corporate model, much of that can be run with health coaches. So it broadens the number of professionals that we can work with to deliver this type of care. The revenue model makes a lot more sense in terms of pricing. We don't have to wait 2, 3 months to get paid. It's a direct pay system. And it allows us to reach those that don't necessarily have traditional insurance care as well. If we can get on some of these platforms, they're not always just for employees. Direct to consumer people can buy those platforms, buy a spot on those platforms, and will be able to become available that way as well.
Okay. This has been really, really insightful. I much appreciate it. Tell our listeners how they can find you, learn more, connect.
So the easy way to find us is on simplexhealth.com. If you are an individual and you're just looking for care, there's a page for you there and you can give us a call or book a discovery call direct from there. If you're a broker or if you are an employer or a benefits platform, then it's just Simplex Health dot partner with us and there's a corporate page and you can reach us there.
Okay.
The buzz has been fantastic. The people that we've been speaking to are really excited about what we have to offer. So I'm excited over the course of the next 12 months.
Yeah. Thank you so much for this, Laura. And please thank David as well.
I will.
Appreciate you.
I will.
Alrighty.
Thank you, Scott.
Cheers. Okay.
Bye.
Thanks for tuning in to this episode of The Wellness Grow Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.